Hello, welcome to our online fertility awareness program. This is the 10 steps for coping with infertility series, and today we are at episode 5. Today we'll be talking about your medical team. So we'll start by reminding us that we have already described infertility as a disease. It is a disease, meaning that it is something that can be treated. We also talked that it has 3 components. It's made up of 3 components: the medical component, the psychological component, and the social component. Hence, infertility is a medicopsychosocial disease. So because it has a medical component, some part of it needs to be addressed or treated in the hospital. And that is majorly what we'll be focusing on today. When it comes to infertility, your medical team is a very vital part of your fertility journey. You should not run that journey or this journey without a dedicated medical team who are worth their salt and know what they are doing to help you through on the process. A lot of people make the mistake of thinking that all doctors should cure everything. That is one very wrong assertion that many people have. And so they have tooth issues and they go to a general practitioner. They have problem with the eye, and then they think that even maybe a surgeon should be able to deal with it. As far as the person is answering doctor, they should be able to cure anything. All doctors have basic knowledge of all kind of diseases, but there are specialists for various fields, and infertility is not different. What do I mean? It means that we have fertility doctors that can help people on their fertility journey. So it only makes sense that when someone is trying to go through infertility and come out successful, that they seek the medical team that can best help them. So generally, you might not know all of this. You might not know where all the doctors are. And so the first thing you want to do is to visit your clinic, wherever you get medical attention from, is to visit your clinic. But while immediately you visit your clinic, if the doctor you are talking with is not a fertility doctor, and you can ask, it's very simple. You start talking about your symptoms and your complaints, and they tell you that, oh, you're diagnosing primary or secondary infertility. They want to send you for a bunch of tests, which is fine, so that they can at least properly classify your condition. That is allowed. But after that, please ask whoever is taking care of you that, what's the next step? Do you have a fertility doctor in this hospital? Are you going to refer me to someone else? It's important. Unfortunately, some of us doctors want to help everybody that we come across, and then we don't get it right, because when we are supposed to refer people to the next port of call where they are supposed to get specialized care, we either forget to do it, or we just get carried away with what we are doing, and then it never happens. It is your responsibility as a client, you who are the person that is going through the condition, to have the information that you need, that yes, you have this situation, you need this kind of doctor for it. Some people are so I don't know the words to use. I don't want to say irresponsible, but their health-seeking behavior is so bad that they are ready to even call whoever they know is a doctor, even whether it is a veterinarian or a dentist or an optician, and they will keep badgering that person for solution to their fertility problems. Even when the person is telling them, okay, go to hospitals, do this. He says, let me just help me now, just help me now. It is wrong practice. Because the person might like, okay, from general knowledge, do this test, from general knowledge, maybe try this drug or things like that. You find out that you might be spending more time and more money achieving almost nothing. Sometimes it might be a simple thing that maybe a general practitioner can just talk to you about, and then you get solution. Maybe like for cases where the problem is irregularity of sexual intercourse, and then the doctor, of course, having that knowledge, takes you through it, teaches you how to regularly meet and why it's important and all of that. the doctor does that and it's fine and you get results, which is good. But it might not always be the case, especially if there are some technical issues with the reproductive system. So what am I saying? It is important to find an appropriate medical team for your situation. Now, the entire fertility process or journey or treatment might not even end with one doctor. You might need a series of doctors to help with the situation. If you are having like endocrine situations now, your fertility doctor might invite an endocrinologist, that's a different kind of doctor, to help you with that. An endocrinologist, that's a different kind of doctor, to help you with that condition, to give you better chances or a better treatment outcome for your fertility challenge. So we need to understand this. How do you start? You start by visiting your hospital. Talk to your doctor. If you have been diagnosed with infertility, work with the doctor to find out what the plan is. If the doctor is telling you that they need to refer you, be referred. Don't just say, doctor, please help me anyhow, just help me, just help me. The doctor might be helping you, but you might not be achieving any result because they might not have all the tools to solve that problem. And when you are referred, the doctor might even tell you, the fertility specialist now might tell you that, oh, you need 1 or 2 more doctors to be involved in your management or in your treatment. Don't think that that doctor doesn't know what he or she is doing or saying, and you want to quickly jump out from there and jump somewhere else where they might better know. And so unfortunately, some of us fall into that mistake of starting all over again and wasting more time because we think, this doctor doesn't know what they are doing, let me go somewhere else. Imagine he says he's going to call another doctor, or he's even going to still refer me. What is the point? You know, this is how medical practice is done. The medical team is a team. There is usually no one doctor superhero that can treat everything. It might not be the case. If the situation is a simple thing, fine, just medication and little medication can solve the problem. But if you need more attention, if you need further evaluation, further investigations, you might even be sent out of that hospital to somewhere else to run some investigations and come back with results. All of that is involved in the fertility treatment. And you need to understand that and cooperate with your caregivers to give you the optimal care that you need to enable you come out from this fertility journey successfully. A lot of people don't listen to their medical doctors. The doctors have told them one thing, and then someone else that is advising them from outside tells them something else, and unfortunately, they tend to believe that someone else. Your medical team is very important on your fertility journey. When you want to choose a medical team, like we have said, first of all, start from any hospital. Ensure that they are giving you the right referrals. Check for facilities that have a track record or known names. They might not have known names. They might be new, but maybe where they are coming from, they have a track record. Do a little research. Find out for yourself. If you would need assisted reproductive technology, what's their success rate like? How many procedures do they do? Ask these questions. It's your right to know. But one thing that you must take away from this video is that your medical team is very vital to the success of your fertility journey, and you should not take it for granted. You should not dilly-dally over it or just treat it like something that is not so important. Seek appropriate medical care for this condition. Don't call a dentist or just a general practitioner for a serious fertility problem. Again, I will reiterate, the first step is to see a doctor wherever you get medical care from. The next step is to know what the plan is if you have been diagnosed with infertility. When they tell you what the plan is, if it involves referral, well and good. Find out where they are referring you to, what their track record is like, what their success rate is like, where that hospital is originating from, and things like that in case it's new. If they are not referring you. Find out if a fertility specialist is in that hospital. If there isn't, ask for a referral. It is your right. Because your medical team is very vital to the success of your fertility journey. Don't treat it shabbily. Choose the best thing that can best support you through the process until you come out successful. We hope this message has touched someone and hope it has been useful. Please, like we say, continue to follow us on all our social media handles. We are on Facebook, Love Foundation, Instagram at Love_Foundation_, YouTube at Love Foundation. Join our support group. The link is in the bio if you are watching this on Instagram, or in the post if you are viewing it from any other of our handles. We hope to see you again next week with another interesting topic. As for now, stay blessed and learn to teach others. Bye-bye.